If you think giving up masturbation is just part of getting older, your body may already be paying a price you never saw coming, and it's costing you your strength, your clarity, and your independence. Hi, I'm Dr. Rabeeca Ross. I'm a urologist and men's health specialist with over 12 years in clinical practice. And let me tell you the truth that most doctors won't say out loud. As you age, ignoring your sexual health is like shutting down one of the last biological engines still fighting to keep you powerful, mobile, and mentally sharp. This isn't about taboo topics. This is about survival. This is about dignity. This is about you. Because when older adults stop engaging in sexual stimulation, even privately, the body doesn't just miss pleasure, it starts to break down. So today, I'm going to show you exactly what happens inside your body when masturbation disappears from your life, and what happens when you bring it back. Stay with me, because each step affects everything from how you sleep, to how you think, to how you feel about the person in the mirror. Make sure you've subscribed. Let's begin. 1. Your prostate, the overlooked engine of comfort and control. I've treated countless older men who quietly confessed, "I just stopped. Didn't think it mattered anymore." But here's the truth no one told them. The prostate is a working organ. It contracts. It releases fluid. It stays healthy through activity. When ejaculation stops for long periods, that fluid stagnates. Stagnation leads to swelling and inflammation, which leads to frequent bathroom trips, weak urine stream. That awful feeling of never fully emptying, increased risk of infections. That swelling snowballs into something common, but extremely limiting. Benign prostatic hyperplasia, BPH. Half of men over 60 deal with it. And here's the twist. Many assume it's just age, but inactivity is a trigger. Now for the hopeful part, regular ejaculation, even through masturbation, helps flush the prostate, reduce swelling, and maintain healthier function. This isn't indulgence. This is maintenance. It's the difference between planning every car ride around bathroom stops and living freely without worry. And the changes don't just stay below the belt. They travel upward, straight into your brain. If you've been feeling forgetful lately, it might not be aging. It might be disconnection. 2. Your brain. When desire fades, so does drive. A man once told me, "Dr. Ross, I walk into a room and forget why I'm there." He assumed it was normal aging. But the truth? The brain depends on sexual stimulation more than most realize. During arousal and orgasm, your brain releases dopamine, motivation, and mental sharpness, serotonin, emotional stability, oxytocin, human connection, and bonding. These aren't just pleasure chemicals. They are powerful protectors of memory focus, stress control, alertness, resilience. When you cut off that stimulation, your brain chemistry stalls, your energy drops, your spark, that feeling of "I'm still me," begins to disappear. And if testosterone declines faster, you don't just slow down, you shrink into yourself. Forgetfulness isn't always a sign of age. Sometimes it's a sign of neglect, and that mental fog brings something even heavier. 3. Emotional balance. When you stop feeling. A widower sat across from me once and whispered, "I don't feel sadness or happiness. I feel nothing." That numbness, not normal. Sexual stimulation, even solo, triggers a release of endorphins, natural antidepressants. Without them, joy dulls. Anxiety creeps in, social energy fades, purpose slips away, weeks become months, and quietly, you stop caring. Older adults often tell me, "I thought I was broken." You're not broken. You're disconnected. Your body still wants to feel alive. It just needs a reason to remember how. And sometimes, that reconnection begins at night. 4. Sleep. Your most underrated superpower. We don't talk enough about this. Sleep isn't just rest. Sleep is repair. An orgasm is one of the most natural triggers for deep, healing sleep. Why? Because after release, the body floods with prolactin, relaxation and calm, oxytocin, anxiety relief, reduced cortisol, less stress and tension. Heart rate slows, muscles unlock, the brain finally shuts the alarm off. Without those signals, you toss, you turn, you wake up every few hours, you pay for it in the morning, and the next day, and the next. Poor sleep doesn't just ruin your night, it chips away at immunity, memory, heart, health, longevity. Imagine giving your body back the ability to sleep like it remembers how, one peaceful night at a time. Next, the silent threat no one warns you about. Your foundation, your pelvic floor, starts to collapse. 5. Your pelvic floor, the foundation, holding everything up. Let me put this plainly. Your pelvic floor muscles are the core of your independence. They support your bladder, your bowel, your sexual organs, your balance, and posture. When sexual activity stops, those muscles stop being activated. Blood flow slows, nerves weaken, muscle fibers fade, and then the symptoms creep in. Dribbling after urination, leaking when standing, laughing or coughing, pelvic discomfort, erectile difficulties in men, vaginal dryness, and tension in women, not life-threatening, but deeply life-changing. I've seen older adults stop traveling, not because they can't afford it, but because they're terrified of a bathroom accident. That is not aging, that is deconditioning, and the consequences ripple further than comfort. 6. Your immune system. Fighting with one hand tied. A patient once said, "I catch every little cold now, and it knocks me flat." We looked at his labs, looked at his lifestyle. Everything seemed fine, except one detail: 0 sexual activity. Here's what research shows. Sexual arousal boosts immune response. Orgasm increases antibodies like IgA, endorphins reduce inflammation and pain. When you remove that, your immune system loses a natural trigger to wake up and fight. You become more vulnerable. You heal slower. You feel older, not because you are weak, but because the body's internal defense system isn't getting the stimulation it evolved to depend on. But now comes the most important piece of all. 7. Self-worth. The identity most people forget to protect. A retired teacher once told me with tears in his eyes, "I don't feel like this body is mine anymore." That sentence haunts me because it's not rare. When you stop touching yourself, you begin to lose ownership of your body. You look in the mirror and see a vessel, not a person. You stop. X, dressing with pride. X, laughing like you used to. X, feeling desirable. X, believing you deserve pleasure. When that connection breaks, your identity drifts. You are still alive, but you no longer feel alive. And that right there, that is the greatest cost of all. Because once you lose self-worth, you lose everything else with it. But here's the truth your body has been waiting for you to hear. This isn't permanent. This isn't decline. This is reclaimable. And the comeback is simpler than you think. Your comeback begins with one private decision. After 12 years in clinics and hospital rooms, the biggest lesson I've learned is this: the greatest threat to aging isn't disease, it's disconnection. When sexual activity stops, especially masturbation, your body loses one of its final built-in tools for circulation, hormonal balance, confidence, brain health, immune support, emotional well-being. But the moment you choose to reconnect, even gently, even privately, your biology wakes up. Blood starts flowing where it should. Signals return. Muscle tone improves. Hormones rebalance. The mind brightens. Sleep deepens. You recognize yourself again. You remember, I still matter. I still feel. I still belong in this body. This isn't about lust. It's about ownership. It's about giving your body the respect it deserves for carrying you through decades of challenges. And still being here, fighting for you. And listen, you are not too old for connection. You are not past the age of growth. You are not a chapter that has ended. You are a story still being written. So what can you do? Starting today, reconnect with your body. Stimulate the systems that keep you strong. Treat pleasure as part of your health routine. Honor the human being still inside you. Your body is waiting for a signal. A reminder, a spark. You can give it that spark. And when you do, things change. Confidence returns. Comfort returns. You return. You deserve a life where you walk tall, sleep deeply, think clearly, and feel fully. Never allow anyone, including yourself, to convince you that intimacy is behind you. It is one of the last superpowers of aging, and you have every right to use it. So if this message lit something inside you, don't let it burn out. Like this video if you believe aging shouldn't mean losing vitality. Subscribe for weekly, evidence-based videos made for older adults. Comment your age and where you're watching from. Share this with a friend who deserves to feel alive again. Because the more we talk about this, the less anyone suffers in silence. I'm Dr. Rabeeca Ross, reminding you that your body still listens, and it will always respond when you care for it. Stay strong, stay confident, stay alive in every way,